This sounds incredibly promising. Walgreens, CVS with the drive-through test at diagnostics agencies. But we sat here in the Rose Garden back on March 13, and these companies were here, some other companies were here. By my count, only 69 drive-through test sites have been set up by the companies that were here. I'm wondering if you, and of course, Mr. Vice President, back in early March, you said we'd be at 4 million tests by the following week. We're just now got there in the last few days. So what have you learned about what went wrong, a month and a half, or over the last month and a half or 2 months, and what's going to go right now? What lessons have you learned from the mistakes over the last, month and a half or so?
John, I appreciate the question, but it represents a misunderstanding on your part, and frankly, a lot of people in the public's part about the difference between having a test versus the ability to actually process the test. I mean, the truth was, when the president tapped me to lead the White House Coronavirus Task Force 2 months ago, we saw the production of lots of test kits going into the marketplace. But as the president has said many times, what he understood early on was the old system would never be able to process the tests at the massive volume that we would need in the midst of an epidemic. And that's why the president brought together these extraordinary commercial labs that you've heard from today, literally sat them down in the Roosevelt Room and said, we need you to turn all of your energies loose on doing the kind of high-speed testing that would be necessary for us to reach the numbers we're at today. And so there was no disconnect at all. There were lots of test kits out there, Admiral, and frankly, there still are today. There are literally millions of tests that could be run in the old-style, slow laboratory that are still conducting tests today, whether it be at the CDC or at state laboratories. But what the president brought about with this public-private partnership has brought us to the point where we've done 5.4 million tests to date, and literally you just heard that by next month we could be doing as many as 2 million tests a week all across the country to give the American people confidence that we can reopen and get our economy moving again.
So when you said 4 million tests 7 weeks ago, you were just talking about tests being sent out, not actually being completed? I'm a little confused.
John, I think precisely correct that in my first week on this job, we were informed that HHS, I believe IDT was the vendor, Admiral Giroir, that had distributed 1 million, was distributing another 4 million, and we believe they did. But again, those were tests that, frankly, but for the president's leadership, we'd still be waiting on those tests to be done in many cases, because they were tests that were designed to be run in the old laboratory model. But early on at the president's direction, we brought in these incredible commercial labs. We partnered with these extraordinary retailers. And now we stand here today, literally one day last week, more than 200,000 tests in a single day. About the time that we were making those comments, we'd done less than 25,000 tests in the entire country. But we've met this moment with American ingenuity, with the incredible companies that are represented here, and we couldn't be more proud.